Hey everybody, my name is Gunnar Sizemore. I'm a sophomore at Providence High School and serve as Visual and Performing Arts Commissioner. I'm excited to be with you tonight to welcome all of you to our fourth conversation in our new series, Providence Connects. Before we begin, let's take a moment to pause, be grateful, and reflect on our mission statement. As expressions of God's healing love, witnessed through the ministry of Jesus, we are steadfast in serving all, especially those who are poor and vulnerable. Providence Connects is a series of conversations designed to bring insights from Providence Health to our Providence High community. It is hosted by Mr. Scott McClarty, who is our head of school. As a native Angelino who has been in education for more than 2 decades around the country, his focus on enhancing the student and family experience and creating connections to the wider community and the Providence health system. Our special guest this evening is Mr. Erik Wexler. Erik is the Chief Executive Officer of Providence, Southern California, a region of the third largest not-for-profit health system in the nation. Mr. Wexler oversees operations across a vast area that covers Los Angeles and Orange counties and the high desert. Mr. Wexler joined the organization in May 2016 as a regional chief executive and worked closely with Providence leadership as it united with Orange County-based St. Joseph Health to form a new organization, Providence St. Joseph Health, with headquarters in Renton, Washington, and Irvine, California. Providence, Southern California employs approximately 35,000 caregivers and has about 5,200 physicians on staff at its 13 hospitals, clinics, Trinity Care Hospice, and its Trinity Kids Care Pediatric Hospice, home health services, wellness centers, Providence High School, and a community investment team that addresses needs in underserved neighborhoods. In his leadership role, Mr. Wexler has developed a centralized team with the goal of continuously improving quality, safety, patient experience, caregiver satisfaction, and operations through innovative evidence-based protocols. The results include national honors for overall quality care, as well as for individual key specialties including cancer, heart, orthopedics, women's services, and neurology. 3 of the region's hospitals, 2 in Orange County and 1 in Los Angeles, were the only hospitals in California named by Modern Healthcare in 2020 among the best places to work in the nation. Mr. Wexler is committed to transparency, regularly updating caregivers via webcasts and meetings with community leaders to expand the role of Providence in the communities it serves. In 2019, Providence, Southern California contributed $394 million in charity care and neighborhood programs to serve vulnerable populations. Formerly the chief executive for Tenet Healthcare's Northeast region, Mr. Wexler said he was drawn to Providence primarily because of its mission focus. Mr. Wexler spent 5 years with Tenet, most recently as chief executive for Tenet's Northeast region, where he oversaw operations in Massachusetts, Pennsylvania, and Illinois. He also worked for Vanguard Health Systems, and prior to that was senior vice president of LifeBridge Health System. Mr. Wexler has an experience in serving large, diverse, and dynamic communities, and leading organizations toward the future of healthcare. He earned his bachelor's degree in sociology and master's in business administration from the University of Hartford in Connecticut. Here are Mr. McClarty and Mr. Wexler.
Thank you, Gunnar. Hi, Erik. Thank you so much for joining us for Providence Connects.
It's my pleasure, Scott. And Gunnar, thank you for that introduction. It was way too long, but you did a beautiful job with it, and it's so nice to see a student. But Scott, good to be with you tonight.
Thanks, Erik. Let's jump right in. Can you start by explaining your role as a regional CEO in a health system and the sorts of issues you deal with, problems you get to solve on a regular basis?
Yeah, I think I would start with the words servant leader. The best way to explain what I do is to convey to you the importance, especially these days, of how I serve others and help them get the resources they need, create avenues for inspiration and for individual success and for our ministry's success. So I see myself as, creating stickiness as part of that servant leadership and driving our organization forward strategically so that we can serve our communities and all of you that are here with us tonight.
Great. And before we jump into the main topic of the night, which is going to be all about the pandemic and the vaccines, big news today in the United States, I want to touch on your own high school experience. And can you tell us a little bit about what it was like for you to be in high school and what impact that experience had on you and your career?
Yeah, and I would say it had as much an impact on my career as it had on my life. I loved high school. I grew up in New Jersey. I went to school at a place called Madawan Aberdeen Regional High School. And, if I think back to the number of years, it was 40 years ago. It's painful to actually say that when about I graduated. There were two things that really resonate with me, Scott, about high school. The first is the friends I made and how close I felt to my friends at that time, and learned things about life that were important in those relationships. And as part of that, the learnings that I had while I was at school, I admit I was not the best student, but I was a student that took great pride in understanding from my teachers at the time the things that were important from a life perspective and from an academic perspective. I think the second most important thing that I got out of high school was something that we're dealing with in our society. It's interesting you asked me that question because I immediately went to this in my mind. When I was growing up in the 70s, there were race riots. I would obviously Madawan Regional High School was a public school, and we lived in a very diverse community. People of color, Catholic people, Jewish people, Asian people. It was a beautiful, wonderful community. But when those riots occurred in other parts of the United States, they found their way to my town. And my my parents and other parents pulled me and the children and families together in one big room and said that we will not participate in those riots. We will support our Black brethren, our beloved neighbors, and we will stand in solidarity with them. I look at what we're going through now in the United States, and I have to say, as painful as that was for me in the 70s, it made me even more passionate about what we need to do now to finally change our society. All of us, your students, their parents, your faculty and board members, and I, and the region. We heard our mission statement from Gunnar earlier, and it really warmed my heart. And vulnerable is something that I think many in our society feel right now and shouldn't. And so, anyway, that high school experience, I think, helped me prepare for today and inspires me even more to want to see change now, once and for all.
That's great. And we'll definitely get in later in the conversation about some of the inequities that we're seeing and that you're working to deal with on the healthcare side of things. And know that you have partners in that work at the high school as part of the region. So let's get into COVID, the news of the day. I'm wondering if we can just start with what you might give as a status report on the pandemic in the Southern California region, its spread, and how you would characterize this phase of the pandemic that we're in right now.
Yeah, I would say, unfortunately, I'm not going to sugarcoat this. Your students are old enough to hear this and mature enough, and I know obviously their parents and families have been dealing with this. Some have probably experienced COVID in their own family. We are at the most serious phase of the pandemic. What you're hearing in our news reports on TV about the number, or in papers and social media, about the number of people that have this virus in LA County and beyond, it's staggering. It is extremely serious because the more people that get COVID, the more that will get COVID. It just mutates so easily from person to person. To give you a sense, if we go back to March and April, so we have 13 hospitals, as Gunnar told you in describing my region here in Southern California. We go back to March and April when the crisis hit us. We had about 250 COVID patients across all of our hospitals. And let me tell you, it felt very, very difficult for us to manage that. A lot of it was learnings that we were all going through at the time. I think there was a lot of fear, and there wasn't enough personal protective equipment, what we refer to as PPE. Even the treatment of our patients, we weren't completely knowledgeable about the best ways to do that. So, now across the world, we've learned about the best ways to do that. Today, as I speak to you, we have 1,058 people with COVID in our hospitals. We're just about out of ICU beds. Where you are in Burbank, our hospital is, for all intents and purposes, full. We are completely out of ICU beds at that particular hospital. We have the ability to flex up by about another 20%, so 120% of capacity. So if we need to, we can take on more. But I would say we're in quite a fix, and the fix for us is, being in that quite a fix space is not as much right now, Scott, about PPE. It's about having the staff to deliver care, because a lot of our clinical team have gotten community acquired COVID. Some, may have gotten it at work, although that number is very, very few and far between. But as they don and doff their PPE, there's a lot of risk in that. So what I ask of all of us is, do not give up on wearing a mask. Do not give up on socially and physically distancing from one another. And do not bring your families together outside of the household now or even at the upcoming holidays.
Yeah, I think that's really, really important. And it's interesting that you talk about ICU capacity and personnel. A lot was made of the governor's new regional designation. So Southern California is a single region now under these new orders. And these new lockdowns were triggered because we had less than 15% ICU capacity. I'm assuming we're almost down to zero ICU capacity in Southern California, even outside of the system, our 13 hospitals as well. And how do you find the personnel needed, even if we go above 100% capacity? I'm assuming you're hiring travel nurses and anyone who's trained that you can get your hand on from around the country.
We are. So, you speak about traveler nurses, or we call them agency nurses, and they work all over the country, and they go to wherever they're asked to be, and they stay in hotels, and they're quite talented actually at delivering care in environments that they haven't worked in every day, because you have to know where the supplies are, and even how to get to the unit that you're working in, and the different types of information systems that we use as well. Usually on normal times, we have 100, so you heard earlier, we have 35,000 caregivers here in Southern California as part of my team. Usually we have 100 or a couple hundred at a high point of traveling nurses, agency nurses. We have well over 300 now. We have another 140 that we've asked to come and help us. Because Providence is such a large health system across the Pacific Northwest and the West Coast, there are other parts of our health system in Oregon and Washington and hopefully soon in Texas, where we're seeing the volume of these cases coming down. They have agency nurses, so they will likely be redeployed to us. But look, another thing that we're doing is, we have a good number of administrative people like me that are executives and leaders across the region. We made the decision last week that every one of us will work at least 1 8-hour shift a week in our hospitals, just doing, either what you are trained to do or being trained quickly to do something to take the pressure off of our caregivers that are feeling very burnt out and really, quite frankly, overburdened at this point. I've done 2 shifts in the past couple of weeks, and I'll be honest and open with you, it was kind of the greatest honor for me over these past months dealing with the COVID crisis to be at the bedside or at the side of our caregivers who are delivering care.
Wow, it has to be quite a different experience going into our hospitals these days compared to just even in mid-March as everything kicked up. It's got to be almost surreal. I wonder too if one of the factors you mentioned earlier that we know a lot more and we've learned globally how to treat COVID patients. And in a weird way, is our increased ability to treat COVID patients actually making the lack of beds worse because we have more people living longer but still needing treatment? So a weird side effect of treating patients better is that they're in our hospitals longer and they take up space that we need because there's so many more people with COVID.
Well, look, it's actually the opposite. That's a very, very good question, Scott. It's the opposite because we know what kind of medications to give to people to try to get them out of the hospital quicker and at home, especially with those that have very, very serious breathing conditions. At the same time, the number of people that are getting COVID is creating more in our hospitals. So, while we're able to reduce that length of stay, immediately right behind the patient that we discharge is somebody else that needs us. Now, I don't want anybody to be confused that's listening to us. The treatments that we have, may be helping those that aren't as serious, or that we're able to, bring the seriousness of the disease more under control. This is a very serious virus. We have seen young people come in and quickly deteriorate, come in and have a hard time breathing, and with hours deteriorate to the point that we need to put them on a ventilator. And some of these people we're seeing that are getting very serious, they don't have what we call comorbidities. So they don't have another disease issue, not all of them, diabetes or other issues that may, create difficulty. So nobody should underestimate that there is an ability for us to easily cure people of the virus and then get them home. But some of the new therapies that are out there are certainly reducing the number of deaths that we have had in the early part of the crisis.
Yeah, that's a good point. I think there's often some misinformation out there that if you're young and healthy and don't have an underlying health condition, that you're going to be fine and it's okay if you get it. So it sounds like you are clearly stating that's not an accurate and certainly not a safe way of approaching this situation.
No, it's not accurate, and I think please heed my warning and my call to all of you that are with Scott and I tonight. I'll tell you what the difference between getting very, very sick or not is, and it has to do with the amount of the virus load that you get. Now, I'm not a doctor, okay? So, I'm conveying to you what I've heard from other physicians, and there's a lot of other things that go into this. But those that come into contact with the virus and a very significant amount of the virus, either through people near them that are sneezing or coughing, and that aerosolized virus makes that into the other person's body, if it's of great magnitude, those are the people that wind up doing the worst. So if you have a mask on, if you're physically distancing from people, that virus, if it does get to you, is tamped down significantly such that you may be able to endure this virus without winding up in an intensive care unit on a ventilator.
Wow. Yeah, it's incredible how, and there's no way to really know, right, when you're in that situation, how much of the virus you've received. Every time you're in the same indoor space with someone who might have it, I mean, you could be breathing it in the entire time.
You can't see it. It's invisible. A loved one could bring it home to your house. From the time that they're exposed, it takes about 2 days from that exposure before you become contagious. And then it could take anywhere between that second day, that 48-hour period, and 10 days before you show symptoms. And you may not even show symptoms. You could be asymptomatic. In other words, you look like you're well, there's nothing going on, but you're spreading the virus. So, look, I know the mask thing is kind of annoying. I wear one all the time. It's just you and I here in our own separate offices. So we don't have to wear it now. But I think at this point, it's probably saved your life and it's saved my life. And one thing I know is that by wearing that mask, if somebody comes in contact with me that has COVID, then the likelihood of me getting very sick is really minimalized.
Yeah. Wear your mask. It's pretty simple. So let's move on without losing the seriousness of the disease itself and what we're dealing with in the hospitals. Let's talk about the hope that is represented by vaccines. We had great news this morning, live images of frontline healthcare workers receiving the first doses of the vaccine across the country. A huge milestone in our attempt at truly and finally dealing with the pandemic. Tell us about what preparations are in place. I understand from our conversation earlier that the first caregivers in the system in Southern California will likely receive their first doses on Wednesday. Tell us about what's gone into preparing even just for the vaccines to arrive and be ready to make their way into arms.
Yeah. Well, we've been working on mobilizing for vaccine administration for several months now. And the first very important activity that we jumped on was, do we have the freezer capacity to store the vaccine? As you've heard, the Pfizer vaccine needs to be stored at least -80. Sometimes we hear -90. It doesn't make a difference whether it's -80 or -90. That refrigeration system or that freezer system you will be able to handle anything if it's the proper one, well below even those numbers. So the first thing we did was we did an assessment of how many of these deep freeze containers we had across our region. And we realized that, we had, a reasonable amount, but not necessarily enough to store the amount of vaccine that would be necessary to administer that twice to all of our caregivers and beyond. So we acquired additional freezer capacity. We have it on the ground. It's been installed, tested for weeks now. And then we started to put a plan together for how we would administer the vaccine, because when you put it in a person the first time, you got to be prepared to get them back to have that second dose within that 3-week period. And so if you don't get that person back for the additional dose, it really doesn't have the effectiveness that's necessary. So that plan to not only identify who it is that gets the dose, and then be able to track them and get them back on that day for their second dose was part of the information system, an app that we put together to be able to track our caregivers through the process. The next phase was to begin to put a team together that could administer the vaccine, and how we would line people up. Now, in this case, social distancing becomes a little less important because they're about to get a vaccine. But for the first vaccine, you want that social distancing such that they're not coming in contact with each other. They're 6 feet apart. For the second vaccine, they may be able to come closer, but we're still going to require masks and at least 3 feet or more apart from one another. And then, of course, the training of our clinical folks to be able to administer the vaccine. Now, that's not complicated because, they give flu shots. They're used to doing this. But there are a good number of clinical people that don't give shots all the time. They were trained to do it. And now it's a refresher course that we need to give to them. So, we are ready for Wednesday. The vaccine is on the ground in a secured location here in Southern California. In a very secure manner. It's being moved and distributed. I can't go into any of the specifics of it, but it will get to our distribution center. And then once we get it to our secure, unidentified distribution center, we will then be able to move that vaccine, and we have a 5-hour period from that central location to where the vaccine administration will be. So obviously, Scott, there's a lot that went into this, but we have, we have planned, we have tested, we have pretended we're administering the vaccine, and we're ready to go.
Wow. Well, let me just say thank you on behalf of all of us at the high school and beyond. It's incredible what you and so many other people across the country have been doing to prepare for this moment. One of the things that I've heard is that there's not a single state in the US that is actually getting enough vaccines in this first round to cover even every essential worker in the state. So that raises a couple questions that I'd love to explore a little bit. One is when will we get enough? What's your estimation that there'll be enough for everyone, even the person who's least at risk, to have access to this vaccine? And two, how do you decide who's going to get it first? Because there's so many complicating factors. There's some good medical ethics at work in all of this as well.
Well, first of all, in terms of the amount of vaccine and how that will be distributed and will we have enough, I think that remains a little unclear, unfortunately. I do have confidence in Pfizer and Moderna, who are the two, Pfizer's been approved and Moderna, we believe, is imminent, is the second vaccine. We have confidence in their manufacturing capabilities and their mass distribution capabilities. And as you may know, the federal government has had for quite a while, led by a 4-star general, something that's called Project Warp Speed. And they have, in conjunction with Federal Express and UPS, have a very, very carefully thought out distribution system. So as Pfizer and Moderna are able to produce the vaccine, which can be done at very significant numbers, I'm confident over the next 6 months, vaccine distribution will continue to pick up. And I hope by the end of 2021, there isn't any one of us that hasn't had our 2 doses. But I can't assure you at this point that is going to happen. So, but let's talk about prioritization, because I think that's critical. The stabilization of the healthcare system is extremely important right now as more people are getting this virus. So what we've got to do is we've got to make sure we have people that can care for people that aren't well. And as I said to you earlier, that's a big problem right now. A lot of healthcare workers across the United States and here in Southern California have gotten the virus. And once they get it, they're out for at least 14 days, but it could be months. So we've got to get that vaccine to people that are in our intensive care units, in our COVID-only units, and in our emergency department. They are job number one for us. And that's not just nurses. It's environmental service aides. It's even social workers. It's a whole group of people, pharmacists and doctors and others. Those are the people that we really need to be protected right away. And from there, we will continue to work to make sure that others that are in other parts of the hospital wind up getting that vaccine. At the same time, our county and state government are working to make sure that they have vaccine distribution to people that live in our community. So that'll be people in nursing homes. It'll be people with comorbidities that are highly at risk. Look, I think this is going to take some time. I think we're going to need to be patient. But I will tell you this. The second I have the opportunity, after all my caregivers come first, to put my arm out and get that vaccine, I'm going to do it. I know there are things people are hearing about being worried and the side effects. So far, the side effects are no different than what we see with flu vaccine. So I'd rather live than maybe deal with a sore arm, or maybe a day where I feel like my muscles may be, annoyed at me, because it feels like I worked out too hard, but maybe I got the vaccine. I'll take that over being in a grave.
Yeah, I'm with you there. I'm prepared to take it when it's my turn and when it makes sense too. And let's stick with this question a little bit. And we haven't switched to audience questions yet, but I see a couple coming in that get at this question. Are there any types of people maybe with some underlying health conditions or autoimmune disorders or anything like that who shouldn't get the vaccine? And should even someone who's healthy consult their doctor before getting the vaccine in case there's something they should be worried about?
Yeah, you're a physician. Before anybody gets a vaccine, there's going to be a series of questions that they need to answer. And so, what will need to happen is those questions will lead to whether there may be a reason not to get the vaccine. And not being a clinician or a physician, I'm not in a position to give expert opinion on that, but I am able to expertly tell you to rely on your physician and what they deem is best for you. I think at this point there are few that will fall into a category of not advised to get that vaccine.
Yeah, and tell us, unfortunately, or the reality is that there is an anti-vaxxer movement out there, not specifically related to this vaccine, but it pre-exists the COVID vaccines, and there's some corollary concern, in some people's minds, like this process has been politicized, it's moved so fast. How could we possibly know enough to say it's safe? How would you respond to that? And how sure are you? And what would you point us to as evidence that this truly is a safe vaccine and that we should all get it unless our doctor tells us otherwise?
Well, first of all, remember this had to go through clinical trials. So tens of thousands of people have gotten this vaccine and have gotten it many, many, many weeks ago, some months ago. As well, the process that pharmaceutical companies to go through with the FDA, it is deep. It is not easy to get through the FDA, and it is not politicized, as we all have witnessed. So, I have to, in my experience and in seeing other vaccines that have come out and in other medications that the FDA approves, the efficacy of what we see that comes out from at least that part of our federal government, as well as our pharmaceutical companies and all the research and work that they do ahead of time, it gives me a lot of confidence. So, we're also, I think we can also rest assured that in places like the UK that is administering the vaccine, and that also has its own process to approve medications through the government, they've had at it as well. Uh, will we learn that there is some issue later? I rather doubt it. I guess, none of us have a crystal ball. I think what we do know is the mortality rate of COVID is something that is very predictable, that we don't need a crystal ball for anymore. A lot of people are dying from that. And so far, those that have gotten the vaccine are surviving and doing very well. So my gut tells me that we need to move away from some of the rhetoric we see in social media. There's just so much confusing information out there that we all deal with. I think we've got to stay focused on the experts. We've got to stay focused on what our own physicians tell us. I tell you, a couple of weeks ago, I had the honor of visiting with Archbishop Gomez. And he and a group of us, small group of us from Providence, were talking about this vaccine. And the Council of the Bishops have supported and recommended to the parishioners that are Catholic to get the vaccine. And he said to me that as soon as that vaccine's here, I would be more than happy to be one of the first people to roll up my sleeve and get that vaccine. And you can take a picture and a video of it, and you can send it out to all of the parishes and schools and anybody who should see it, to let them know that I've got my vaccine.
Wow, that's great. And he, we're lucky to have Archbishop Gomez as the current president of the U.S. Conference of Catholic Bishops. And so him doing that really sends a message to other bishops across the United States, which is great. I'm glad to hear that he's so actively supporting the vaccine. I know that it seemed, I watched a little bit of the live vaccine um, distribution this morning. It's really just like getting a flu shot, right? I mean, it's nothing to fear separate from that. And I know there are some people are saying you might get sick afterwards, and aren't you putting the virus in you? But that's actually not the case with this vaccine, right? You're not actually getting the coronavirus as a part of the vaccine, right? So can you tell us a little bit about that? Make sure people aren't confused.
Yeah, so I'll give you my non-clinical, but I think fairly consistent knowledge on this. First of all, it's what Pfizer has done is they've taken aspects of the DNA of the virus and not the virus itself, and they created a vaccine from aspects of that DNA that would be administered into our system and that activate a response from our system that creates immunity. So what it does is it teaches our system, our body, to fight the disease by taking just an aspect of it, not any part of the virus that's unsafe. And so it's not giving you the virus. The virus would be giving you the entire, all the DNA is the best way to describe it of what exists. This is just a piece that tells your immune system to go fight it. So on the first dose, just like a flu shot, it'd be given to you, administered exactly the same for all intents and purposes. You probably, at least the experience right now that we've heard is you won't experience much of anything. On the second dose, 3 weeks later, you may have some flu-like symptoms. As I said, fatigue in your muscles, but not fatigue so that you feel incapacitated, but like maybe you had a really hard workout, or you just had kind of a general malaise type feeling, but maybe not even enough to prevent you from going on with your daily activity. Your arm might be sore, but other than that, the symptoms are really far and few between. I've heard of a couple of cases where people have gotten a temperature and it disappeared, within 24 hours, and they were fine and right back at it. So if you get the second dose and you don't feel well, then stay home and rest. And the next day, I feel pretty confident in telling you you'll be right back at it.
That's great. And actually, I've heard that it's actually a good sign, because it means your body's actually, the vaccine's producing an immune response. And
That's
that
exactly
means
right.
it's actually doing its job in your system. So it's little confirmation that that things working.
Yeah, I'm glad you remembered to say that, because I think that's a very important fact, that those side effects are a good sign.
Yeah. So there's another question from the audience, that's, I think, a really, really good one. If you have the antibodies, presumably because you got COVID earlier in the pandemic, you recovered, you had an antibody test, you have it, should you still get the vaccine? Or most people, should they still get the vaccine even if they have the antibodies?
Yeah, the recommendation so far is get the vaccine, even if you had COVID before and you have the antibodies. There are some situations that we unfortunately know about where people have had COVID and they've gotten again, or they were tested and they had antibodies and they went up getting COVID. And so what we know is this portion of the DNA, as I describe it, that turns on the immune system to go after exactly what it needs to, especially on the second dose, is much more effective than the antibodies that may be coming from those who already have had the virus.
Great. I want to cover two more questions, and then we'll wrap things up. It was really helpful to hear you describe the difference between the first and the second vaccine, and even that you might be able to, you still wear a mask, but you might be able to get a little bit closer. I just want to make sure that we're clear on this. Even after you get the first vaccine, you should still live your life as if you don't have the vaccine, as if you have no immunity. Continue to wear a mask, continue to keep physically distant, and not spend a whole lot of time indoors with people outside of your household, correct? You wouldn't say that once you get the first
Absolutely.
vaccine, go out and party.
No, or the second vaccine.
Mm.
Look, for the next year, we're all getting used to it. We're wearing masks. I know it's uncomfortable, but for the next year, my prediction is we're all, vaccine or not, going to need to wear a mask. That is the best way to eradicate this virus once and for all. And look, what I think has happened to us in the United States is, we had this kind of COVID hangover, where we thought it was the cases were beginning to disappear and we could relax a little bit. Now we're at the worst part of the virus transmission that we've seen, and many, many, many more people are dying. So we got to kind of do a double, triple protocol thing here. Get the vaccine, continue to wear your mask, don't let your guard down, continue to physically distant from others. And, in a year from now, let's pray that we can get back to our normal lives and we can take our masks and we can put them away or in the garbage once and for all.
Well, thank you for that. There's one last topic I want to make sure we cover, because I actually mentioned it. We briefly touched on it early in our conversation, and that is about the systemic inequities that certainly already existed in healthcare and in other aspects of our country and our society before the pandemic, but have really been exacerbated and revealed in significant and troubling ways because of the pandemic, especially with people of color. Can you tell us about what you're seeing? Are those trends still there as we're getting deeper into the pandemic? And what are you doing? What is the system in the Southern California region doing to address those inequities, at least insofar as we can?
Well, health disparities, as much as the systemic racism that we've seen in our society, they pain me. They should pain every one of us. And so I'll stay away from systemic racism and just focus on health disparities, because I could go on probably too long about.
We'll have to have you back.
I would be delighted to, because I'm very passionate about this, and I think it's something we all need to finally change. So let me focus on health disparity. I can tell you right now, the most number of COVID cases that we are seeing are at our at-risk communities and San Bernardino County, and in parts of LA, and in a couple parts of Orange County. And so part of this is, where our communities, where there are people that live together and, have not been given the ability to have economic freedom, and so live with a number of family members in one house, or work in the type of job that puts them at risk to be close to other people. Those kinds of careers have put those communities at very serious risk. And so in San Bernardino, which I would say is the hottest spot in Southern California right now, the number of COVID cases is catastrophic. So what are we doing? First of all, Providence St. Joseph made a commitment to dedicate $50 million over a certain period of time and put that into at-risk communities to try to improve the healthcare of those that live in those communities. Immediately, the Southern California region, through our Diversity and Inclusion Council, began to work on ways that we could do that by helping right now during this COVID crisis. So of the 50 million, we have a $1 million grant that came to Southern California. And we are placing in those at-risk communities COVID kits. So it includes masks, it includes educational materials in various languages that people hopefully will be able to spend time with and understand and learn how to protect themselves. It will provide them with a conduit to providers so that they can be cared for access points to our urgent care centers. So look, I think that's a very small step in helping to decrease these disparities. But I'm hoping of the $50 million that we will continue to draw upon that and focus our time in those communities to try to improve the care that people receive.
Wow, thanks, Erik. I'm sure we could probably go on for another hour to unpack so much of this conversation, but we are out of time. I am so grateful, Erik, for you spending your time with us and sharing your insights this evening. And before we sign off, I want to say a quick word to our students and families and just ask that you truly think about what you heard in this conversation and have a conversation about it after you power down your screens. Whether you're alone or with your family, what connected with you? What resonated with you? What are you going to carry with you into your endeavors tomorrow and the days ahead when you interact with people virtually because you're not interacting with them in person? And lastly, I just want to thank the team here at Providence High School and our partners at the health system for supporting this program in some truly extraordinary ways. You can watch the recording of this conversation and all of our future and past Providence Connects programming at providencehigh.org/providence-connects. Thank you. Stay safe. Merry Christmas and happy holidays, and go Pioneers.